this research day is a forum where the residents and the fellows can share their research and their progress with their peers, their attendings, and the faculty.
It's an impressive show of research activity, mainly led by our trainees and supported largely by the efforts of our faculty, who have done a wonderful job in mentoring our residents and guiding them through the process of designing projects and bringing them to fruition and presentation.
I think what stands out about this year is that there are a few submissions of work that is trying to use new technology, specifically smartphones and internet-based technology, to integrate this kind of technology.
I spent time in Kasoro, Uganda, and I tried to coordinate consultation of certain cases by taking pictures and sending them over the internet. And over the last couple of years, we've tried to coordinate evaluating and helping with cases in Uganda. And this sort of naturally led to trying to develop this into a more efficient system using smartphone technology and using proxies such as medical students that are rotating there to be the proxies and collect cases and even do biopsies. And I think this has worked really well, and it's established a really good educational relationship as well as a potential to really reach out in a charitable way.
We see a lot more this year on race. We see a lot more on issues of obesity and diabetes. There's a very nice poster on HIV infection showing that adherence is lower in some of our black community, which correlates with increased death. And that's an important piece of information to know.
We wanted to go back and look at why it is that people of African descent appear to have higher death rates from HIV. And so when we looked at all of the women that were on treatment for HIV, and we controlled for socio-demographic variables like drug use and smoking and education and income and their levels of their T cells and their viral load suppression, we found that black women were more likely to die of AIDS as compared to white women.
One of the markers in the lab that we've come across, CTHRC1, has been found to be expressed in both these murine models as well as cells that have actually been cultured from, derived from human rheumatoid arthritis patients.
And some of the database research that the residents are doing means they're asking questions about patients and about the kinds of patients they're seeing and trying to answer those questions and for very practical results.
My work covers two very important public health issues right now, obesity and diabetes, and kind of provides mechanism, probably one of the many mechanisms of why this is happening, why obese people are more prone to getting diabetes.
We see this year many more posters who have been, the fellows of which have been mentored by hospitalists. So we have a broader base of mentors and I think a broader base of the sorts of research and a bigger representation of patient-based and clinical research, which is absolutely where we want to go as a clinical department of medicine.